What about lung cancer and getting a port? So, I was diagnosed with lung cancer at just age 28. At that time, I was a teacher, but even with all of that education and like access to knowledge, I was still pretty passive in regards to, making decisions about my health because I trusted that my oncologist, who had gone to college or university for like over 10 years, was telling me what was in my best interest. But really, all right, so I'm going to show you my port. It's right here. It's a little bumpy. But if I had known what I know now, is that I would have asked questions like, is the port necessary? Because I was told I was just gonna go get it. And I was like, oh, like it's actually necessary. Um, the original plan for me was to have 6 rounds of chemo, and I understand some people may need it, but in my case, I actually ended up only doing 2 rounds of chemo, right? And it's bumpy. I still have it. I only did 2 rounds, and there's the scar now. I think just like looking back, I wish I could go back and go in that clinical room setting and say, like, hey, could I just do chemo and get like poked in my vein instead? And then if I need more chemo, then I will go get the port. Like, I understand it makes it easier for medical providers to give me like the medication, like the chemo, right? But personally, I think during that operation when they were inserting the port, I was awake, and I think a little bit of the anesthesia wore off, and it just, I didn't have, I mean, even now when I remember the experience, I didn't have the most fun time. I remember like feeling a little bit of the suture go through. I was awake, and then I could see like that crumbly paper. I just wish I didn't have to do that. I wish that I was told there was an option that I didn't have to go through and get that port. So, yeah, if you are on an oncologist and your patient doesn't need that much chemotherapy, then maybe present it to them as if they have an option to get the port. And if you are currently, newly diagnosed, I'm so sorry. But also, yeah, ask that question and make the decision on your own. Because, yeah, like looking back, I wish, even if I had needed it, I wish I had been given, the time or the option to actually make the decision for myself to be inserting this thing. Because also the other thing is that I need the port flushes now, even though it's not being used like every 2 months. Sometimes it gets stuck and I have to like go through the port flush even earlier than the 3 months. So yeah, that's my experience with the port for getting my lung cancer. I have this bumpy thing. I mean, I don't really mind the scar. I think it's just, it was such an uncomfortable thing to be awake for. But yeah. What are your experiences if you have a port? I would love to hear about like your surgery experience with the port.